Right, you're on.
Okay, so now we're going to see how Zoe does this. Clearly she's a lot taller. Do we need to have this much clearance? We don't. Let's say she's someone who had back surgery maybe about 4 or 5 weeks ago. This is going to be far too aggressive. So let's just do it with up at about 1. Okay, come on up. So that way, most of her trunk is, some of her trunk is actually supported by the pad. This is fantastic because this is what her upper body now can get controlled by her lower body. So we have her use her arms to lower herself to the appropriate, what's it called? Mid-range position into flexion. There we go. She relaxes her buns, relaxes her stomach. Let yourself drop down a little bit lower. There you go. Now can you use your arms a little bit more so that you're taking the low back pressure off? There we go. Now slowly press your legs into the back of this thing right here. There you go. And that, you can see her back is working a little bit, but it's not the only thing working. And you can see her hamstrings and, come on, a little more glute. There you go. Hamstrings and glutes are firing now. Then she takes her hands away. There we go. And she stayed put. And this is a fantastic exercise. And it's pretty hard, right? Just doing this in and of itself is really hard. Do we have her practice coming up and down? We do not, right? Because the pad is too high for her, and if she comes forward and down, she's going to be getting it from lumbar spine flexion, which is not what we're trying to train with this exercise. If we were going to come forward, we're only trying to train the femur rotating down and coming back up because the hamstrings are activating and controlling that motion up and down. Great. So now, let's say your surgery was maybe 12 weeks ago. Your therapist is excited that you're doing really well. And they say, hey, let's do this next set. So, put your legs up into it. You've already done this exercise. It's not like this is a brand new thing, but I'm going to tell you, instead of just staying put here, like so on this angle, at this 45-degree angle, now what we're going to do is put this on your back and help you learn how to lift it and lower it by making your hips move only. So if you put yourself in a good alignment. Perfect. One hand on here. There you go, behind it like that. And one hand there. And now, same thing. This comes up and off. Good, and now pull it back on. Can you do it wrong by tucking your buttons under? So here, now tuck your buttons under. There you go. Hold on 1 second. So now, you can still see it's on her back and her thorax, and her butt is completely rotated posteriorly. So if she rolls back up, now she's getting it all from here. So you can come on down. So what we really want to see is only motion from the upper body coming from the innominate rolling off of the femur, not just the innominate rolling and then the lumbar rolling and then the thorax rolling. Make sense? Okay, come on up, Megan. So let's see how she does this. We know we're going to put this down for you soon. There we go. All right, patient. See how your back is doing there. Not bad. Can you bring yourself up? Woo! What does she do? Come on down. Do it again. She starts from where? Keep going. Lumbar. And I don't think she's doing that on purpose. Okay? So, what we want to train her to do is put one hand behind the head. There you go. One hand behind. And she's got her palm side down. I like it when the palm is up so that it's back. It's just a little easier on the arms usually. So from here again, I'm going to tell her lengthen this out so that this part is coming off of the pad. Both sides. Yep, off of the pad. There you go. And as you come back up, these bones pull straight down towards your legs. They're starting. There we go. And I literally just put my hands on the part that I want to move, right? Or these guys right here. This is going to come off of the table. There you go. Now this start pull. Nope, that's your back. Try it again. Right here. This pulls. That's your back. How about this? These guys. These pull. Yeah, there you go. And boy, does she have a hard time. And you'll see she's getting a little bit of a pull, but really her brain goes right back to here. So let this part come off now. It comes off of the table. There you go. Now freeze there. Don't lift your chest. Your chest is just going to get carried by your hamstrings pulling you. Yeah, that's your best one yet. Best one yet. Best one yet. That's it. And then come back down. Now I'm going to pretend I got 5 other patients going on. Okay, this is perfect, Megan. You owe me 20 of these, okay? So keep going. Come up and down. There you go. I'll be right back. Then I come back. How'd your 20 go? Okay, great. Come on down. Okay.